Hello everyone, this is Al, your Medicare Maniac, talking to you today about hospital care, inpatient care. This is a Part A covered service. The information I'm sharing with you comes from the Medicare and You book. This is a 2020 version. And so this is the official government handbook that Medicare sends all Medicare beneficiaries. And if you would be so kind, turn to page 27. On page 27, this is how Medicare defines hospital inpatient care. It has two names, hospital care or inpatient care. So here we go. Medicare covers semi-private rooms, meals, general nursing, and drugs as part of your inpatient treatment and other hospital services and supplies. This includes care you get in acute care hospitals, critical access hospitals, inpatient rehabilitation facilities, long-term care hospitals. And please note, those are all in blue. If you're using it on the internet and if you click on each one, it will give you the definition of each blue highlighted term. Continuing on. Inpatient care as part of a qualifying clinical research study and inpatient mental health care given in a psychiatric hospital or psychiatric unit within a hospital. This does not include a private duty nursing, a television or phone in your room, if there's a separate charge for these items, or personal care items like razors or slipper socks. It also does not include a private room unless medically necessary. If you have Part B, it generally covers 80% of the Medicare approved amount for the doctor services and you get while you're in the hospital. Okay? So, first bullet says you pay a deductible of $1,408 and no coinsurance, meaning no percentage, for days 1 through 60 of each benefit period. You're going to pay a coinsurance amount of $352 per day for days 61 through 90 of each benefit period. You pay a coinsurance amount per lifetime reserve day after day 90 of each benefit period up to 60 days of your lifetime. So what they're saying is they're going to cover from days 90 through 150, 60 days, 60 days. That's it. Okay? You pay all costs for each day after you use all your lifetime reserve days. Inpatient psychiatric care in a freestanding psychiatric hospital is limited to 190 days. So as you can see, Medicare does have limits. If you go in the hospital for psychiatric care, they're only going to cover up to 190 days. Now, all those blue terms that you found on page 27, let me define those for you. Critical access hospital is simply a small facility that provides outpatient services, as well as inpatient services on a limited basis to people in rural areas. Inpatient rehabilitation facility is a hospital or part of a hospital that provides an intensive rehabilitation program to inpatients. Long-term care hospital is an acute care hospital that provides treatment for patients who stay on average more than 25 days. Most patients are transferred from an intensive or critical care unit. Services provided include comprehensive rehabilitation, respiratory therapy, head trauma treatment, and pain management. Deductible is the amount you must pay for health care or prescriptions before original Medicare, your prescription drug plan, or your other insurance begins to pay. Always have to meet a deductible before insurance kicks in. And last but not least, coinsurance. The amount you may be required to pay as your share of the cost for services after you pay your deductible. Coinsurance is usually a percentage, for example, 20%. So the coinsurance is simply referring to the percentage you have to pay. Going on. So more vocabulary explained. Benefit period. The way that original Medicare measures your use of hospital and skilled nursing facility services, a benefit period begins the day you are admitted as an inpatient in a hospital or skilled nursing facility. The benefit period ends when you have not received any inpatient hospital care or skilled care in a skilled nursing facility for 60 days in a row. If you go into a hospital or a skilled nursing facility after one benefit period has ended, After 60 days has ended, a new period begins. You must pay the inpatient hospital deductible for each benefit period. There's no limit to the number of benefit periods. So every time you go in the hospital, 60-day period. Once you get out, 60-day period, right? So let's say you go to the hospital in January of 2020 and you come out in January at the end of the month. You go back in July. What happens? Do you have to pay again? Yes, you must pay again because a benefit period covers 60 days and you're further out of 60 days, so you have to pay again. Lifetime reserve days. In original Medicare, these are the additional days that Medicare will pay for you when you're in a hospital for more than 90 days. You have a total of 60 reserve days that can be used during your lifetime. For each lifetime reserve day, Medicare pays all covered costs except for your daily coinsurance. Now, we're on page 28 now. Okay, we're on page 28 of your Medicare and U book. Am I inpatient or outpatient? This is very important. Staying overnight in a hospital does not mean you're an inpatient. Your doctor must order your hospital admission, and the hospital must formally admit you for you to be an inpatient. Without the formal inpatient admission, you're still an outpatient, even if you stay overnight in a regular hospital bed and or getting emergency department services, observation services, outpatient surgery, lab tests, or x-rays. In bold, you or your caregiver should always ask the hospital and or your doctor if you're an inpatient or an outpatient each day during your stay, since it affects you what you pay and can affect whether you qualify for Part A coverage in a skilled nursing facility. You can also ask the hospital social worker or patient advocate if you're not sure. Medicare, the next paragraph states a Medicare outpatient observation notice, MOON, is a document that lets you know you're an outpatient and not an inpatient in a hospital or critical access hospital. You must receive this notice if you're getting observation services as an outpatient for more than 24 hours. The MOON will tell you why you're an outpatient receiving observation services rather than an inpatient. It will also let you know how this may affect what you pay while in the hospital and for care you get after leaving the hospital. That's a lot of details to talk about hospital care, but as you know, hospitalization is a very important benefit that is covered under your Part A benefit. I hope this explanation helps you. Thank you so much for your time and have a great day.